Hello, this is Beth here from International RN, and today we're going to be talking about the professional values station for your OSCE exam. So this is a 10-minute written station. It should be one of the last stations of your exam, so by this point you're probably feeling quite tired and you just want to get out of there. Okay, so for this you have 15 different topics. I'm going to put them up on the screen for you. Don't worry, it's quite similar to evidence-based practice. You don't really need to know in depth about any of these topics. Please don't spend time studying them. What you do need to study, as always, as I always say to you, is the marking criteria. Absolutely. So for each scenario, there is a specific marking criteria which you need to have written the points from that marking criteria in order to pass. So please try your best to read all of the marking criteria before your exam, and even better, practice all of them, not just for this but for all of your stations. I know it's a very big ask, but that is the most important thing for your exam. We will go through one of the scenarios shortly and I will show you the marking criteria and everything. So 10 minutes written station. So a few points which are common in all of the scenarios you may have. So it says acknowledge the need to keep and uphold standards and values set out by the code. And the code is split into 4 sections if you don't know this already. Prioritise people, practice effectively, preserve safety and promote professionalism and trust. So that needs to be in all of your answers, no matter which scenario you're allocated. Obviously, handwriting needs to be clear and legible. So when you are practicing, please practice writing it by hand. You know, if your handwriting is a bit scribbly, please work on that before your exam, because I have had nurses fail in the past because their handwriting isn't legible. And remember, we want to make it as easy as possible for that examiner to mark you. We don't want her having a hard time trying to read your writing, and also it's not very professional. But most importantly, you need to pass that exam. Okay, so we're going to go through the mock exam now, which is available on the Exam Centre website. So I'm going to put up on the screen for you also, but in case you want to go back to it another day. And if you want, you can pause the video and then practice it yourself, and I will go through the answers with you. Okay, so I put the scenario up on the screen for you. This is the practice scenario for the mock exam. So if you do want to review this scenario, it is in the mock exam, which is available online. And if you just keep on scrolling past the API section, it's there at the end. So this is about basically observing a colleague taking codeine tablets themselves, and yeah, you need to answer the question to it. So within your time frame of 10 minutes, you will be expected to read this read all your paperwork, so you don't have additional time for that. So let's have a look through what you need to do. So if you want to, you can have a go now and at answering the question, and then pause this video, and then we will go through the marking criteria together. Okay, so let's have a look at the marking criteria. So first point is quite straightforward. So recognises that taking NHS or hospital property is prohibited. So I'm sure you would have mentioned that somewhere in your answer. So you could write, when I observed my colleague taking this, I understood that this is not allowed. This is against a policy. Something like that. Obviously, it's a narcotic medication. They shouldn't be taking it. Something along those lines. Okay, next point. Recognises professional duty to report any concerns that may result in compromising patient safety. So obviously, your colleagues probably shouldn't be doing it, for one, but they probably can't work now as well as they would normally be, so their performance is impaired. So you would need to raise that to your line manager and complete an incident report. And obviously, if you fail to report this, you will bring your own fitness to practice to concerned. So raises concerns with manager at earliest opportunity, verbally or in writing. recognises the need to be clear, honest and objective about the reasons for concern, reflecting on duty of candour. Next point, recognises that the manager may wish an incident report to be done. So I hope you've mentioned that in your marking, in your answer, just tick that off. Recording the event, step taken to deal with the matter, including date of time and who the concern was raised. Take into consideration own responsibility for the safety of the colleague and considers the effects of codeine on their ability to work or drive home. Consider that the colleague may need a medical review for the headache or may need support dealing with substance misuse problems. And then this is the last one, which I said about with the NMC code, acknowledges the need to keep and uphold standards and values set out in the code, prioritise people, practice effectively, preserve safety and promote professionalism and trust. And obviously handwriting is clear and legible. So I hope you've got all of those answers. Obviously, if you're struggling with this station, feel free to contact me with any questions, or you're welcome to join our next class. Also, if you have a reset on this, please contact me as well, because we will be more than happy to help you. And I would advise, now you've practiced this one, to go and have a look through some of the other scenarios, as many as you can, ideally before your exam. Okay, good luck with your OSCE exam.